In patients where no polyps are present, then there is a recommendation that 3 months of antibiotics are given. And I'll talk a bit more about that in my research talk later on today. So, where we move forward, well, certainly my feeling, and I spent also some time training in surgical approaches to the nose and sinuses in Canada and Vancouver. One of the things that was a unique moment for me when I went there was that I'd seen this sort of concept of taking out polyps from the nose where the nasal polyps are present, and then waiting for the patient to come back 5 days later and performing the operation again, perform the operation another 5 days later. And so patients go around this cycle. What I was taught there was actually, that isn't necessary. You can do an operation once, you do it well, and actually with the right medical treatment, this problem can be controlled. So it's about long-term use of medication in conjunction with surgery if surgery is needed. So this idea of patients going around a loop of repeated polypectomies should, I hope, be something we start to confine to history archives. In the past, there are a number of ways of approaching sinuses. The equipment and technology we have now is a lot better than it used to be. And so as time goes by, I think we will see a field change. But in the past, people have used sort of different approaches to sinuses, such as going through inside the mouth, old-fashioned sort of windows into the nose and sinuses. And largely, I think those things are being confined to history archives. And a lot of people have experienced going through sinus surgery and had this awful experience of having the nose packed and sterilinised. And really, again, sinus surgery should be a day-case procedure. The nose shouldn't need to be bunged up to the high heavens. And it should be a tolerable experience rather than an unpleasant repeated event. What we started to do at the James Paget Hospital is perform sinus surgery with the use of image guidance, and that allows us to map the sinuses during the surgery. This isn't really a new technique, it's really just another tool. So there are lots of tools that we use in operating theatre, and this tool allows me to really have a kind of hands-on feel about the anatomy inside the nose when we're operating, and allows us to be very sort of thorough and precise during the surgery. Those of you that may have experienced sinus surgery, you may have heard the term functional endoscopic sinus surgery, a term that was coined in the 80s. This term can actually cover a range of procedures. It doesn't necessarily mean that there's really a consent form all these things get done. And often, just the two things at the top of the procedure get done. It's important really that the surgery is focused on all of the sinuses are affected rather than just a limited approach, because the long-term results will tend to be better, but demonstrating that is work that we still need to do. We reported our sort of experience from Vancouver about the long-term outcomes of patients going through sinus surgery. This for me is what I want to see after the operation. The patient has been looking after the nose very well. We've got a nice, healthy lining to the nose, I can see right up inside the forehead, and hopefully the patient's symptoms are well controlled. But this isn't always that easy, and it is always about how we look after the patients in the clinic. But that said, with the use of this technique, we can actually reduce the amount of revision surgery down to somewhere around about 3 to 5% mark over the longer term. The national average at the moment is about 20%, so hopefully we can start pushing things in the right direction. This is a symptom score chart, so all the patients come to my clinic, but that's we've got a SNOT 22 questions all about symptoms related to the nose and symptoms of general well-being. You can see here the patient came in, got a score of 60, and we gave him some medication, got somewhat better. We came back and said, well, there's room for improvement. And they said, okay, well, we'll offer to do some surgery for you. And there we are with surgery and medication combination. Further down the line, we've actually got someone who's symptom-free. So symptom-free status is possible in some patients, and certainly controllable situations are possible. But not all of you will experience sinus disease, so what else is available? Well, these are a number of things that have been tried in studies elsewhere. And at the moment, and I'm going to talk about this more this afternoon, one of the things we're able to do is set up more trials to investigate these medications properly. So some of these things are things that I can try in the clinic. One of these things is something we're trying as part of the study. And some of these things are things that you can go away and try yourself. And I've had a couple of people who've tried immunoglobulin after post-viral factory loss and been very happy. Acupuncture is something you can certainly arrange through your GP. and some people find it beneficial. It won't work for everyone. That's our leaflet about smell training. I won't really go into the lecture and talk about it lots later on. In terms of this qualitative loss, that's this kind of distortions. Most of the time, actually, reassurance and watchful waiting is the right first step in dealing with the actual loss rather than this distortion. However, if it becomes a real problem, if it becomes a really unpleasant thing that's actually taking over the individual's life, then the first thing we can actually do is actually try and block the nose. We can do that medically using decongestants. Now, decongestants, you think, well, that's to unblock the nose. Actually, if you abuse decongestants for more than about a week, the nose swells up. So actually, we can make the nose swell up using decongestants and actually try and block the signals you're getting. Some patients actually find when a clip on the nose is a simple way of dealing with the problem. However, if that hasn't worked, then we can use a drug called gabapentin, which may help to modify the nerve signal in some people. Putting in mind the States described operating on patients in severe cases, and what they did was they pasted cocaine, we used cocaine medically, or decongesting the nose for surgery, and pasted inside the top of the nose where the receptors live. If the patient then has an absence of their problem, you can actually then, you suggest to remove the tissue at the top of the nose. And that's quite a radical step, not one that I've ever done, but obviously that would be an extreme sort of event if all else had failed. And that's basically summarising. So if you've got a loss of the quantity of smell, then the first step is to try some steroids. We can then try alternative medical options, which you see on the previous slide. We can consider looking at smell training and unconventional options. But if you've got this distortion here, then what we should do first is this a problem? We should treat this first, and then try blocking the nose, nerve modifying agents, and the surgery option is a really big last resort. Obviously, as you're aware, there are these psychosocial impacts. So, do you need to consider how this impacts upon you for your daily life? Do you need to take action about that? So, we hand out information sheets about domestic hazards. So, it should be labelling food, you should be fitting gas detectors, or relying on members of the family to check things for you. And certainly, dietary advice is important. And something that I think Duncan will probably come back to later on to certainly get some feedback from you about how perhaps your diet has changed for the better or the worse and the consequence of being an hospital. So those are things that we bring up on our information sheet. And certainly if this is an issue for you with your work, then this should be discussed with your manager and, if necessary, supported by a letter from a doctor such as me to underline the problem. There are things that certainly we can do, and again, it's going to talk about this more today, to try and enhance food enjoyment. And this is our kind of sheet that's based on some work we've done in Texas and the States. I know Duncan discussed it yesterday and felt that perhaps actually these spice combinations may not necessarily be the right way forward, and again, this is something we'd like to get some more feedback and information from. So, in summary, you can understand that smell loss has both conductive components, so travel of the signal to the top of the nose, and conduction of the signal to the brain and beyond. True taste is rarely affected, so most problems are down to smell loss. As you're aware, there are social and psychological impacts on well-being. The most common causes in total are the sinus disease, the common cold, the head injury, and those of unknown origin, and they account for somewhere between 80 to 90% of all the cases I see. It's important that things are investigated thoroughly, so don't be fobbed off if you haven't investigated thoroughly, and don't be sort of just told that reporting the scan is fine, because the scan needs to be looked at in your presence, and I always try and talk people through the scans in front of the clinic, so they can understand with me what the problem is, or actually understand that the scan is actually completely normal. So there are treatments available. I can't say that they're comprehensive and they're going to be effective for everybody, but we can certainly do more than perhaps has been suggested in the past, and we need to work on more treatments in the future, which is what I'll talk about later. There we go. So, a bit of bedtime reading for you. I know Duncan's already mentioned my Birmingham. I actually read this book myself this year, and I thought this was a great book, because for me, as a clinician, I thought this made the problem very understandable to the average reader. I thought it was great with the way that she'd taken the subject and she really studied it from a lay perspective and she translated that to a general audience. So I think it's a great read to every person that's there. The book on the right is a book that I read about understanding the role of sense of smell in culture and history. I think very fascinating, something you may be interested in. On that note, I'll finish with the words from William Shakespeare. Thank you.